I am going to palpate the bony features of the distal femur. This is the anterior view of the knee flexion. First, I am going to locate the patella. Going to the side will be the medial and lateral condyles of the femur. As you travel proximal to the condyles is where the medial and lateral epicondyles located. For the tibiofemoral joint, first locate the tibia and going proximal on the medial side inferiorly from the condyles, you will feel a line there that is a depression of the tibiofemoral joint line. For the tensor fascia lata, first I am going to locate the iliac crest and the ASIS where its proximal attachment of the TFL muscle, and that is a 2-inch region, and going down about 3 fingers wide.
Everyone, I'm Aliyah Jasmine Alceneras, BIS PT1B from Group 2. Today, I'll be palpating the medial condyle, lateral condyle, tibia of tuberosity, crease of the tibia, and lastly, the fibular head. In this video, I'm gonna be palpate the medial condyle. To start off, we need to be able to identify the condyles of both femur and the tibia. I'm going to bring the knee up into a flex position and then to take advantage of the rotational part of the tibia to try to identify where the tibia is moving. So, on the femur, I'm able to feel that joint line right here on the medial aspect. I'm going to bring the leg down, and just proximal to that is the medial condyle. Next, I'm going to be palpating on the lateral condyle to try to feel the lateral again, trying to identify that joint line between the tibia and the femur, which I've identified right here, the proximal. So that is the lateral condyle. I'm going to palpate the tibia tuberosity. I have my patient sitting right now to have the best possible view from the camera. I'm going to start off is the kneecap, also known as patella, and I'm going to find that right here is not very hard to find. And what I'm going to progress my fingers down and right below until I feel a bump and move my fingers down. Move my fingers down and very early to the kneecap and to feel the bump. Okay. The bump is called the tibia tuberosity. To palpate the anterior crease to the tibia, that's the most prominent part of the tibia. If you were to kick, somebody gonna hit that first. It's like a kind of like a rooftop. Alright, so if you look at the bone here and you see this kind of the crease up here, that's your anterior crease of tibia. To palpate the head of fibula, if you identify the tibial plateau and palpate along the rim of the tibia and here and keep going backward, and then about 2 centimeter off that you're onto the head of fibula, Here you can also come up with the fleshy part on the outer aspect of the leg, lateral aspect of the leg, and your onto here of the fibula, grabs it between your fingers, and that's your head of fibula.
Hello, my name is Janie C.D. Kalub, and for today I am going to palpate the quadriceps femoris muscles and the gracilis. Together with me is Joy Kalub, who already gave us her approval to be our patient for this time. So quadriceps femoris is made up of 4 muscles that are responsible for flexing the hip and extending the knee. So let's start off with the first muscle, which is the rectus femoris. So the rectus femoris is located on the anterior thigh and is the only quadriceps that crosses 2 joints, the hip and knee. So the rectus femoris can be palpated if the hip is flexed and knee extended. So from its attachment to the patella, we will ask the patient to flex her hips and then extend her knees. So upon these actions, we will feel that there is a bulk in this section, and this is where we can confirm that this is the rectus femoris. And then next, we have the vastus intermedius. The vastus intermedius is deep to the rectus femoris. However, its edge can be palpated if the rectus femoris is grasped or lifted somehow. You can also move it aside, the rectus femoris, and from doing either of these actions, we will ask the patient to flex her hips and extend her knees. And then there, we will be able to palpate the vastus intermedius underneath the rectus femoris. Then we have the vastus medialis. So, the palpable portion of the vastus medialis, or the distal portion, is quite bulky and can be palpated medially on the lower third of the thigh. So it can be palpated if we ask our patient to extend her knee. And then there we will feel this bulk, and this is the vastus medialis. Next is the vastus lateralis. So the vastus lateralis is the sole muscle of the lateral thigh and can be palpated below the greater trochanter down to the patella. And we will be able to palpate the muscle if we ask our patient to extend her knee. So from extending, we will see that the muscle around here is contracting. So this is the vastus lateralis. And that is for the quadriceps femoris muscle. Next to the list is the genioarticularis. However, this muscle is too deep, which is why it is not palpable. So we will now proceed to the gracilis of the hamstring muscles. So the gracilis is attached on the anteromedial side of the tibia, and it is beside the sartorius and semitendinosus. So we will able to palpate the gracilis if we will resist knee flexion. So we will ask our patient to resist knee flexion to activate the gracilis. So, here the side. Okay, anteromedial section. And then there we will feel the bulkness around this area, and this is the gracilis.
Today, we will be palpating the palpable bony features of the patella, namely the inferior pole or the apex, the superior pole or the base, and the anterior surface of the patella itself. For the posterior surface, we will be palpating the posterior lateral facet and the posterior medial facet, and also the posterior odd facet. So now we will begin with palpating the inferior pole or the apex of our patella. So we will begin by having our patient seated and knees slightly flexed. So from the patella, we will move our fingers to the inferior angle of the patella. And here we can find the inferior pole or the apex of our patella. So this area right here is our inferior pole. And in order for us to palpate our base of the patella, we have to move our fingers superiorly or proximally to the upper margin of the patella. And here is the base of our patella. There. So for the anterior surface of the patella itself, we have this area, the most front or the anterior part of our patella. Moving on, we will be palpating the posterior surface of our patella. So given from its name itself, in the posterior surface, we cannot completely palpate the posterior surface of the patella, and we are only limited to palpating the edges of those features. So to start, we will begin by tracing our femoral condyle. So to palpate the posterior lateral facet of our patella, we will trace the lateral femoral condyle to the lateral edge of our patella, and from here we can palpate for the posterior lateral facet of our patella. In order for us to palpate for the posterior medial facet, we need to trace the posterior medial femoral condyle from here down to the medial side of our patella. And then for our odd facet, we just need to move inferiorly and there.
So good afternoon everyone. My name is Vincent Arcite from PSPT 1B, Group 2. And for this day, I will be palpating the knee flexor muscles. That includes the hamstring muscles, the biceps femoris, semitendinosus, and semimembranosus. Aside from that, I will also be palpating the gastrocnemius and soleus, and as well as the plantaris, popliteus, and the sartorius. So let's get started. So the first hamstring muscle is the biceps femoris. Now by the name it suggests, or it implies, it is a two-muscle belly, or a muscle that has two muscle belly, and found in our femur, femoris. So there you have it. So for our biceps femoris, or should I say all of the hamstring muscles, they have a common denominator for us to palpate them easily. So the three hamstring muscles can be palpated first by asking the subject or our patient to lie in a prone lying position, and the common action that is needed to resist is knee flexion. So by palpating the three hamstring muscles, all we need is just to resist knee flexion. Okay, so let's begin with the biceps femoris. So our biceps femoris is the lateral hamstring. Now by knowing that, we could know that we could palpate the biceps femoris at the lateral side of our thigh. Now, before I proceed, the hamstring muscles are the muscles found at the posterior compartment of the thigh. Okay, so unfortunately, I could not assure that you could see the muscles because my brother here is healthy, so yun siya, napapasarap yung pagkain niya, nakakain niya, so medyo malusog-lusog siya dito banda, so hindi siya basta-basta makikita yung ating muscles dito. So I apologize in advance. Now, let's continue. For the biceps femoris, once again, the lateral hamstring. First thing to do is to resist knee flexion, and knowing that the biceps femoris originated from the ischial tuberosity and insert the long head inserts to the head of the fibula as well as the short head. So our long head can be palpated from its attachment on the head of the fibula to the ischial tuberosity. So resist knee flexion. So we can find here, so you can try this at home. So here, banda yung ating long head, while the short head lies deeper or deep to the long head. That is why it is difficult to palpate. So once again, lateral hamstring, resist knee flexion, and lateral hamstring. We could palpate here. Now tendon niya dito. So ganyan, nandyan po ang ating long head. Now for the short head, then deeper siya ng ating long head. That is, it is hard to, or difficult to palpate. And another way in palpating the biceps femoris is to request the patient to sit in a sit position and to rotate its leg in a lateral position with respect to its femur. Now, it is another way lang in palpating the biceps femoris. Now, if our biceps femoris is lateral hamstring, the next one, the semitendinosus, is now the medial hamstring. So here, dito banda, so just punta ka lang medially, then knee flexion once again, and you can see here, our semitendinosus, medial na siya. Since our semitendinosus originate from the ischial tuberosity and insert sa ating upper part of the medial surface of the shaft of tibia. So, from the insertion itself, resist knee flexion, then medial here. So, biceps femoris. So, mahirap talaga siya palpate. Di talaga siya makikita. Even me. But if I will do palpation to myself, I could feel the contraction by doing its action as well as knowing the origin, the insertion, and also by that I could easily locate now the muscles. Yan siya. Another one, the last one, is the semimembranosus. Now the semimembranosus originates once again from our ischial tuberosity, and it inserts ating medial condyle of tibia. Now, our semimembranosus has the largest cross-sectional area out of the three hamstring muscles. And also, it cannot be easily palpated because it is covered by the semitendinosus mostly and proximally by the adductor magnus. So, itong ating semimembranosus lies deep to our semitendinosus, and mostly ng muscle na ito is natatakpan or covered by our semitendinosus. But still, let's try to palpate it. Now, to palpate, so since larger cross-sectional area siya, so if we locate the semitendinosus, palpate lang natin yung sides ng semitendinosus. So, still, dito pa rin siya banda sa ating medial side ng ating thigh. So, dito siya banda kasi, dito siya banda sa proximal, because if we go here distally, dito na banda yung ating tendon. So, once again, biceps femoris, dito banda, resist knee flexion. So, mahirapan talaga ako mag-palpate. Dito banda yung ating semitendinosus and semimembranosus. So, ayan siya. So, once again, to easily remember the hamstring muscles, just ask the patient to be in prone lying position and resist knee flexion. And once again, our hamstring muscles can be found or located here in the posterior compartment of the thigh. And that are the hamstrings. Observe that if you plantar flex your leg, or should I say quinto, as you say in Bisaya, we could observe a bulge or a huge bulge here at the posterior compartment of our leg. That is the gastrocnemius and the soleus muscle. Now, it is one of the easiest muscles to palpate that can be palpated. first thing to do, or the most basic thing that we need to ask our subject, is just to plantar flex. Sir, kindly plantar flex or tiptoe. Now, our gastrocnemius have two heads, and it crosses the joints of the knee joint and the ankle joint. Now, our gastrocnemius is superior to the soleus. As you can see here, it can be easily found or located. So, nasa proximal banda yung ating gastrocnemius. Yan siya, the more huge, or yung mas malaking bulge. So, relax muna, sir. Nanginginig ka na. And tiptoe ulit. Okay, and as you can see here, my curve dito rin banda. It is very visible. Ayan siya. So, ito yung very matigas or parang mag-bulge dito. And just distal to it, because it is also deep to it, we have here now the soleus. So, as you all know, the gastrocnemius and the soleus action is to plantar flex. That is why if you're going to do those action, the gastrocnemius and the soleus will be contracting. Therefore, if we're going to palpate here at the proximal part, the gastrocnemius, it will harden because since it contracts, and at the distal part, the soleus. And okay, you may relax, sir. And the gastrocnemius, just a short trivia lang, the gastrocnemius and the soleus form the triceps serrate. So once again, gastrocnemius and soleus, we just need to ask the patient or the subject to do plantar flexion. And that is for the gastrocnemius and soleus. Plantaris muscle. So plantaris muscle have the same action with the gastrocnemius and soleus. However, it is very difficult to palpate based on the brainstem. It is not always present. It follows along the medial border of the soleus. So, let us try to palpate if we can, but it runs very deep to the gastrocnemius and for the soleus. So, here, it lies proximal to our gastrocnemius. So, as you can see here, you can see now already, it is very visible, the gastrocnemius. And to palpate it, you're just going to stick the thumb here at the popliteal space and do flexion, and just see if there is a small muscle contracting that runs obliquely, just superior to the gastrocnemius. However, just as I said a while ago, it is difficult to palpate. But just in case, as long as you know its location, which lies here, since it inserts to the posterior surface of the calcaneum, and it originates in the lateral supracondylar ridge of the femur. So by knowing its original insertion, you could locate it, and as well as you could assume at what part this muscle or the plantaris muscle might be located. And also based on the book, or based on Brunstrom, it is a small muscle in the posterior of the knee, and it plays a little role, and specific function is unknown and still is not yet that really known or recognizable, and it is not always present. So once again, that is the plantaris muscle. It is difficult to palpate. Up to the last muscle, we have the popliteus muscle. Now, it is one of the deep root muscles found at the posterior facial compartment of the leg. Even though it is a small muscle, it plays a big role or an important role. It aids in providing both a static and dynamic posterior lateral knee joint stabilization, and it lies deep in the posterior knee. So, nasa posterior knee siya. It is very deep, and it is because of its location and its position, it is hard to palpate. It is difficult to palpate. But just for some information lang, it originates in the lateral surface of the lateral condyle of femur and inserts the posterior surface of the shaft of the tibia above the soleal line. So once again, the popliteus is difficult to palpate because of its deep location, and position. Last muscle, we have here at the anterior compartment of the thigh. We will be identifying or palpating the sartorius. The sartorius comes from the Greek word sartor, which means tailor, and that is why our sartorius is also considered as the tailor muscle that describes the hip's seated position when muscle performing three hip actions: flexion, abduction, and lateral rotation. Now, our sartorius is considered to be the longest muscle in the body, stretching from the ASIS, or the anterior superior iliac spine, down to the upper medial border of the shaft of the tibia. So once again, it's considered as the longest muscle of our body. Now once again, as we locate here, the ASIS, anterior superior iliac spine, going to the medial border or the upper medial border of the shaft tibia. So now by knowing its location, to witness or to see the sartorius in action, you just need to ask the patient first is to lie in a supine position, and to ask the patient to do flexion, knee flexion, 90-degree knee flexion, hip and lateral rotation. So flexion, then hip and lateral rotation. So technically, we're just doing a abduction of the thigh. So once again, location of the ASIS. Now, our sartorius is thin. It is very thin. It is a thin muscle. So even though now you can palpate it from the ASIS, but at some point when you're going distally, you might be lost. You might not trace the sartorius anymore, and it is normal. It's just normal. So once again, from the ASIS down to the upper medial border of the shaft tibia, considered as the longest muscle, just ask the patient to lie in supine lying position, do hip, lateral rotate the hip, and 90 degrees flexion of the knee and the hip. There you have knee flexion, then lateral rotation. Now, so it is hard to palpate here with my brother. So once again, malusog siya na bata. So yun, so here, once again, so dito lang banda, then just trace here sa medial border ng ating shaft tibia. And there you have it for the sartorius. Thank you for